Hello and welcome. Today, we're breaking down a topic most men avoid talking about: erectile difficulties. Whether you're in your 20s, 40s, 60s, or older, struggling to achieve or maintain an erection can feel confusing, embarrassing, and even frightening. But the truth is simple: you are not alone, and most causes are completely fixable. In this video, we'll explore the 10 real medical reasons you may be losing erections, backed by urologists and sexual health doctors. We'll also explore what these issues feel like, why they happen, and the small steps that may help you improve your performance naturally. Let's get started. Doctors agree an erection is basically a blood flow event. Blood must rush into the penis and stay there. But if your circulation is weak, slow, or blocked, erections lose strength or disappear completely. Poor circulation is often caused by sitting too much, high cholesterol, high blood pressure, clogged arteries, lack of exercise, and aging. Men describe this as feeling numb or getting halfway hard before it disappears quickly. Why does this happen? Because when arteries get stiff or narrow, the penis becomes the first place that shows symptoms, as its blood vessels are tiny. Doctors often say erectile issues are sometimes the earliest sign of heart problems. This doesn't mean you have heart disease, but it does mean circulation deserves your attention. Testosterone is the ignition key for a man's sexual drive and performance. When levels drop too low, many men notice fewer morning erections, weak libido, less firmness, and slower arousal. Low testosterone becomes more common after age 30 and even more after 50. Doctors explain that low T doesn't always stop erections completely, but it makes them harder to achieve and easier to lose. If you feel tired, unmotivated, or less confident, and also notice weaker erections, hormones might be involved. Your mind can shut down your body faster than any medical condition. Stress, overthinking, and anxiety trigger cortisol, a hormone that blocks your natural arousal. This is why you can watch adult content and perform fine, but struggle with a real partner. Because your brain is too busy thinking instead of feeling. Doctors often see this in younger men. The body is healthy, but the mind is overloaded. If you've ever thought, what if I fail? Or what if she judges me? Your brain may be blocking your erection before it even starts. Depression doesn't just affect mood, it affects sexual function. Men may feel no desire, no interest, and no physical response. Some medications for depression can cause sexual side effects too. Doctors usually reassess dosages or switch medications when needed. The key point: mental health and sexual health are deeply connected. Diabetes is one of the strongest medical causes of erectile problems. High blood sugar damages blood vessels, nerve endings, and sensitivity. Even men with borderline or undiagnosed diabetes can feel the effects. Signs can include tingling, reduced sensation, slow erections, and difficulty maintaining hardness. Doctors call this vascular and nerve-related ED. The good news is better blood sugar control often improves performance dramatically. Excess weight affects hormones, circulation, and inflammation. Men with belly fat often produce more estrogen and less testosterone, tilting the balance away from sexual desire. Doctors say belly fat is particularly harmful because it lowers testosterone, slows circulation, and increases pressure on pelvic blood flow. This combination leads to softer erections and less stamina. Smoking damages blood vessels. Alcohol slows the nervous system. Both directly weaken erections. Urologists often say smokers develop ED 10 years earlier than non-smokers. Even weekend drinking can disrupt nerve signaling, blood flow, and testosterone levels. If your erections are much weaker after drinking, this is very common. You're not alone. Good sleep equals good hormones. Poor sleep equals poor sexual performance. Men who sleep less than 6 hours regularly have lower testosterone and higher stress hormones. Doctors also notice that men with sleep apnea often experience ED. If you snore heavily, wake frequently, or always feel tired, the problem might be sleep, not sexuality. Some very common prescriptions can affect erections, including blood pressure medications, antidepressants, anti-anxiety drugs, prostate medications, and some antihistamines. Doctors can usually adjust or switch medications, so never hesitate to ask your physician. Often, the solution is as simple as a small change in dosage. The penis has some of the smallest arteries in the body. So, when blood vessels start clogging, the penis is the first place symptoms appear. This is why ED can be an early warning signal for high cholesterol, high blood pressure, artery stiffness, or early heart disease. Doctors often say erectile problems can be the body's way of whispering, check your heart. Erectile problems can feel stressful, but most causes are treatable once you understand what's happening. Circulation, hormones, mental health, lifestyle, and overall heart health all play a role. If you're struggling, remember, you're not failing. Your body is simply giving you information. And with the right steps, better sleep, movement, lower stress, healthier habits, many men see improvement naturally.